Welcome to the Clinician's Corner, the go-to podcast for functional health practitioners who want to deepen their clinical skills and deliver exceptional client results. I'm your host, Margaret Floyd Barry, Master Restorative Health Practitioner and Executive Director of the Institute of Restorative Health. Each week, I interview leading experts to bring you the latest research, case studies, and evidence-based strategies for reversing chronic disease with actionable insights you can implement immediately to elevate your practice and transform how you deliver health. Welcome, everybody, to today's episode of the Clinician's Corner. I'm super excited about our conversation today. Not only do we have the fabulous Dr. Doni Wilson, who I'm going to introduce you to in just a moment, we're going to talk about something that I don't think gets nearly enough attention, which is HPV. So we're going to talk about this from a functional approach, which also I think a lot of people are not even aware exists. So Dr. Doni Wilson is a naturopathic doctor, professional midwife, clinical nutritionist, best-selling author of Master Your Stress, Reset Your Health, and an internationally renowned speaker and thought leader in women's health. For over 25 years, she's been on the cutting edge of healthcare, helping women to transform their health naturally. Dr. Doni's HPV protocol has helped over 10,000 women to clear high-risk HPV to negative and prevent HPV-related cancer. Incredible. A true advocate for women's health, she's dedicated to empowering others to take control of their healing, drawing awareness to the profound impact of stress and trauma on the body. Dr. Doni, welcome.
Thank you so much. I so appreciate having the chance to come talk with you and connect with your audience.
I'm so glad that we're having this conversation for all the reasons I just said. I don't think it's discussed enough. And I don't think that people even think about the fact that there could be a functional approach to it. So where I want to start, even though as clinicians, we all, know vaguely about HPV, I actually realized when I was preparing for our conversation today, how little I actually know about it, right? Mm-hmm. So human papillomavirus, I'm saying it, I had to look up the full name. We just think of it as HPV. Can you explain exactly what it is? What are the implications and what are the considerations when it's high risk in particular?
Absolutely. And it's true. We talk about human papillomavirus as if it's a single virus. And actually there's identified over 150 types of HPV virus. 14 at this point in time, what we know of as 14 types that are associated with cancer risk. And that's when it gets labeled a high risk type of HPV, is when it has any association with cancer risk. Now that cancer risk is in men and women. So a lot of times as women, we're the first ones to find out that we're testing positive for HPV, because now at this point in time, when you go to the gynecologist for a gyne exam, a pap smear, likely the doctor is going to also test you for high-risk HPV. That wasn't always the case. 30 years ago, we were not, even 10 years ago, we were not testing everybody for HPV. Now, in fact, when women go for a gyne exam, your doctor might actually start with the HPV test even before doing a pap smear, because over 90, something like 99% of cervical cancer is caused by high-risk HPV virus. And so if a person's testing positive for high-risk HPV, that's when we need to start looking for abnormal cells and risk of cervical cancer. But that's not the only kind of cancer that HPV is associated with. It's also associated with vaginal cancer, vulvar, anal, and oral or head and neck cancers. And in men, head and neck cancer as well as anal and penile cancer are associated with high-risk HPV. Wow. It's just that men are not usually screened for high-risk HPV. So men don't usually find out that they have it until they get cancer, unfortunately. So I look at it as, at least as women, we're more likely to find out before it turns into cancer, which means we have an opportunity to do something about it. And from my clinical experience of helping women for over 25 years with this, is that these cancers associated with HPV are preventable. We see women preventing these cancers over and over, and yet that's not something that they're hearing from their doctor's office. And so this is such really a silent epidemic that women are going through. They're finding out that they test positive for HPV, that they have a virus that could cause cancer,
Right.
And then they're sent home in fear, wondering if that's going to happen to them without any kind of help of what they can do.
So many things I want to touch on in what you just said here. There's so many different pieces to this. So recognizing the prevalence, that's really fascinating, because I actually thought, even as a kid, when I first started getting my very first pap smears as a teenager, I can still remember the first one. It was a nightmare. But I actually always thought that that was a piece of what they were looking for. But that's really interesting that it's only become routine in the last 10 years or so. And how are they diagnosing it medically? And I want to talk about this. We're talking about women here, but the really important point that you just made, that this is not, it's a sexually transmitted disease. So clearly it's not just women. So how is it diagnosed both in female and male populations?
So what happens is, when now the testing for HPV is so advanced, and when we do testing for other viruses, oftentimes it's an antibody test, right? We're looking for antibodies, let's say, to EBV or HSV, which is herpes virus. We're looking for an immune system response. When it comes to HPV, the testing is actually very specific. It's not looking just for an antibody response. It's actually looking for presence of the virus down to the DNA of the virus. So the testing that exists is very highly sensitive and can tell us, is there any DNA of the virus present or not? And I think this is where a lot of the misconceptions come in, is because people don't realize that the testing is so much more advanced that we can literally know whether the virus is present or not. And when the virus is negative, when the test is negative, that means a couple things. It means that you can't give it to another person.
Yeah.
Which is good news, right? Because it's like, a lot of times women really get stuck in, hey, if I'm testing positive, does that mean I can have sex with my partner? Can I date? What if I give it to someone? Am I going to feel bad if I give? And we get into this spiral of concerns. But if it's negative, you can't give it to another person. And if it's negative, it can't cause cancer.
Yeah.
So I learned through helping women that this is our new goal. The goal is, we want HPV negative, because when it's negative, we're not passing it to anyone else and we're not at risk. It's just that that's not the goal you're going to hear from the doctor's office. So I just want to make that distinction of, like, most practitioners. In fact, when I was in naturopathic medical school over 25 years ago, I didn't learn that either. This was not, the testing wasn't advanced then, and we didn't know that we could get the virus down to negative. And so things have really changed in that way, and yet it's still not into the standard approach. In terms of prevalence.
Can I actually just ask one question before you go on to the next piece? I think this is a really important piece. So does this mean that, unlike, we think of somebody who gets herpes or who gets, any kind of virus, we think that that's just now you got to live with it. This is a forever thing. And it's all about managing your health and taking really good care of yourself so it doesn't flare. So am I understanding correctly that what you're saying is that we can actually get rid of the actual virus and be done?
Exactly.
That's amazing.
It is. It is. And so it really changes the whole game, the whole goal, the whole perspective on this. And we're not hearing about that, right? Women are finding out that they're testing positive, but they're not hearing. In fact, they're hearing the opposite. When I survey women who contact me, most of them are told that they will never get rid of HPV, that they're going to have to live with it for the rest of their life, that all they can do is have surgery to remove abnormal cells and hope that it doesn't turn into cancer. And this is so defeating. Of course, women go into a spiral of despair. If you hear that because of a sexual exposure, you now have a virus that could cause cancer you're going to have to live with for the rest of your life. What could be more stressful than that? And I just can't believe that that's what's being told to women. I understand it, because I know that I didn't learn the truth when I was in school either. The way I learned it was by helping women coming to me and saying, is there anything you can do? And at first, my goal was to help them reverse abnormal cells and heal their cervix and prevent a progression. But then, and we can talk more about this, I started having women come back with their test results showing negative, not detected HPV time and time again. And I have cases of women who now it's been 10 years, 15 years, still negative. So that's when I started realizing something different's going on here. This is actually where we're clearing the virus. And then I looked in the research, and the research and immunologists have known this. In the research, they talk about how actually, when you think about it, the number of people who are exposed to high-risk HPV is a huge number. We're talking
What are the prevalence rates, just generally?
80% of us by age 50.
Yeah.
If 80% of us are exposed to this virus by age 50, so that's a huge number. In some research from 2018, which is a number of years ago, there were a worldwide 37 million women were testing positive for any strain of HPV in 2018. So it's a very high exposure. We literally, even though we think this is rare, it's not rare. It's actually very common. So if you think of how many of us are exposed, and then you think of how many people develop cervical cancer, for example, which is worldwide, just over 600,000 women are diagnosed with cervical cancer every year. So it's not that everyone who gets exposed gets cancer.
Right.
And so whenever we look at those numbers and we go, well, what's happening there? In fact, the research shows that 90% of us will completely clear the virus, meaning 2 negative, it's gone, within 2 years of testing positive. So if 90% of us are clearing it, what I started to do is I started asking what's happening in the people who are not clearing it. Why is it that for some women it persists beyond 2 years, and for some women it ends up causing abnormal cells and cancer? Those are the women who are needing help. 100%. And we need to start asking, what's the difference? Why is their body not clearing it? First of all, realizing that the human body can clear it, and that's very obvious in the research. And second of all, well, what's happening when the body doesn't clear it, and how can we help their bodies to clear it?
Fascinating. Can we, before I asked about males being, and I want to make sure that I don't forget that before we get into this, because that is, I want to dig into all the juicy details of this, but I want to make sure that I don't forget the male piece. So when and how are they being diagnosed for this, since it is just sort of assumed that it's a female issue?
Well, there isn't an equivalent to a pap smear for men. And so oftentimes men only find out once they develop a tumor or cancer.
Right. It's retroactive.
Then they go, oh, this was caused by HPV. And so men, the way I look at it, men didn't even have a chance to be preventing. Right now, women are not having a chance to prevent either, because they don't know that they can prevent it unless they found me. And so for men, I do find, though, some men have been able to, they found, like, let's say they were diagnosed with abnormal cells even before it became cancer, or once it becomes cancer, they're treated for cancer, but the cancer treatment still doesn't kill the virus. And so the virus can cause cancer again. And so a lot of times people will reach out to me, including men, when they have been diagnosed with abnormal cells and they don't want it to recur again. Or in some countries, men are more often screened for HPV. And what I'm also seeing, Margaret, is that there are HPV tests available online. So both men and women can test themselves for HPV from home. And I'm already seeing a trend in that direction, and I think it's going to increase, that people are going to realize, hey, this is something I can test myself for at home.
Right.
And then if I am testing positive, then I can be proactive and I can communicate with my sexual partner and we can do something about this. And so I'm seeing more men test themselves, even though it's not being tested. I think it should be something that honestly happens when we go see the dentist, because oral HPV, you can test a dentist could check it when you go for a dental exam, but it's not happening yet.
So the at-home test, is that a finger prick?
It's a swab. So you can do a vaginal swab, or you can do a genital swab, or you could do an anal swab, and you send it in and they do a PCR analysis to identify the DNA of the virus.
So simple. Mm-hmm. I love that they're providing that access, and even more reason that we've got to get these folks connected to you and this methodology. So tell us what you found looking at these people who aren't actually progressing to cancer, and what is the difference between these two populations?
Exactly. This is exactly, to me, the most exciting part is that, and actually you're going to love this because it comes to these root causes that we're used to thinking about with other health issues.
Yeah.
Of course, it comes back to some of these same root causes. And the number one root cause that I see in women across the board is exposure to stress and trauma. And this is also documented in the research. There's research to show that, for example, women who experienced abuse in childhood, which could have been sexual abuse, but it also could have been any form of abuse, physical, emotional, psychological abuse, any exposure to abuse in childhood increases risk of cervical cancer by 96%.
Wow. I'm writing that number down.
and this is not something that it's being acknowledged or women are being told. And even then women might be like, wow, yeah, okay, the stress from my childhood increased my risk. And now what do I do about it? And so yes. I'm saying that as practitioners, when we see a woman who's coming in with an abnormal pap smear and HPV, we need to be thinking about helping her to recover from stress and trauma, because likely she had a traumatic exposure from childhood. Also, any exposure to trauma or violence in their relationship as an adult, it could be divorce, it could be loss of a loved one, it could be a toxic relationship. All of these factors increase risk for women for HPV and cervical cancer. And so we need to be thinking that as clinicians. We need to be thinking abnormal pap smear, what kind of trauma has she been exposed to, let alone the trauma of dealing with HPV? Because what's happening now as women are going in for this gyne exam, you talked about how the gyne exam, can be, even one pap smear can be traumatic, let alone these women are having to go back in and get a biopsy of their cervix, sometimes procedures to remove abnormal cells like LEEP procedures, conization where you remove part of the cervix, or even doctors may need to start considering a hysterectomy. And women are being put into the position of going through repeat biopsies, repeat procedures over years of their lives. Sometimes I'm hearing from women who are going through this for decades, and that causes so much medical trauma for them that only perpetuates the risk of HPV.
The Clinician's Corner podcast is sponsored by the Institute of Restorative Health, the premier clinical training program for health practitioners who want to learn how to finally get to the root source of their clients' health concerns and help them reverse complex health challenges and chronic illness. You can't afford to keep guessing. Your clients can't afford it either. Today's clients are sicker than ever before. Their health histories are more complex than ever, and you simply can't deliver results they need or build the practice you desire without the right clinical skills. Enter the Institute of Restorative Health. Our clinically proven, systematic approach to restoring balance within the body has helped thousands of practitioners transform their clients' lives, grow their business, and change the way health is delivered. Study with us to develop and master the clinical skills and confidence you need to help your clients feel better, faster. Learn how to work with advanced lab testing to identify imbalances, craft custom targeted protocols that truly resolve your clients' health issues, and deliver consistently life-changing results. Visit instituteofrestorativehealth.com to apply today and secure your spot. Yes. It's so sad the way these things, nobody goes in with the intention to hurt another person, but it's really sad to see how the intervention itself can be actually dramatically contributing to and exacerbating the very thing that we're trying to address and heal.
And so I help women to understand that and to say, hey, now that we see that this this state of fear and anxiety that they're in, having to deal with HPV, that we can do something about that. We can help women to break free by helping them become informed, not only about the virus, but what they can do to protect themselves from the virus. Because to your question, there's so much we can do if we start addressing root causes, and I can go into more details on that, but there's so much then we can do to help each of their bodies to protect themselves from this virus.
So the stress and trauma piece, this is huge. And I had a question for you here of like, what are some of the factors that you see that would predispose somebody to HPV? I guess I shouldn't be framing it as HPV, but to high risk HPV that could lead to cancer. And so let me just play it back to make sure I'm pulling all of these pieces together correctly. But it sounds like that history of abuse, stress, trauma, which honestly, isn't it everybody? I mean,
yes,
I know not everybody has had sexual abuse, although a shocking number have, and alarming, especially when you start to have conversations with people and realize that the vast majority have. And then was it 1 in 3 women who have had some kind of sexual assault? That's just women. And then, of course, you will need to have the intercourse. You need to have exposure to the virus. Is there anything else that you see that just predisposes them to the virus specifically? I just want to talk about that piece first, and then layer in the escalation from there into cancer.
Well, you reminded me, one really important misconception is that we tend to think that this is women who are promiscuous, having more sexual partners, that you think, and of course, if you have more sexual partners, you have even greater likelihood of exposure to this virus. But ultimately, even women with 1 or 2 sexual partners can still be exposed to high-risk HPV. So it's not just about multiple sexual partners. And people think, oh, of course, with sexual abuse, they got exposed because of the sexual abuse. And I'm here to say it's not just about the exposure. It's about what happens when this virus lands in your body, and how prepared is your body to protect you. And what happens when we're exposed to abuse and trauma and stress is that it lowers our immune function.
Yeah.
And so if our immune function's down, then we're going to be less able to protect ourselves from a virus. So even if we simply look at it from the perspective of stress, lowering immune system, lowering our capability to protect us from a virus like high-risk HPV virus, let alone if you look at the impact of stress and trauma on cortisol levels, and then the gut health, right? How well we're absorbing nutrients, our microbiome. And of course, the gut microbiome is connected to the vaginal microbiome. Yeah. So if the gut microbiome is disrupted by stress, so is the vaginal microbiome. And the vaginal microbiome is meant to make sure that foreign things like a virus are not able to get into the vagina and survive. But if our body has been under stress and our microbiome is depleted, it's not going to be able to protect us from high-risk HPV. So it's like this. It's like a snowball effect. From the stress and trauma, it just creates this snowball effect that makes women and men susceptible to high-risk HPV.
So it feels like we're really thinking about the same kind of factors from a functional perspective that we're really thinking about, whether it's autoimmunity or migraines or skin infection. I mean, I think really when you start talking about the fact that that the compromised immune system and all of the factors that go into that, from the gut to escalate, chronically elevated inflammation levels, of course, obviously the stress that you've already talked about. I can imagine things like nutrient sufficiency, oxidative stress, like all of these different components are going to play a really important role in equipping the body to be able to kill off the virus and handle the virus, or conversely, to create an environment where we're really compromised and vulnerable to a virus.
Yeah, so much of it is we've been focusing on the wrong thing. I mean, we're focusing on the virus and it gets our attention and it's scary, and we can test for it, and we're like, oh my gosh, I got exposed to the virus. And for many women, their mind really gets stuck there. How did I get exposed? And they're feeling regretful, shame, guilt, resentment about the exposure to the virus. And yet really where we need to put our focus is on her internal ability to protect herself from the virus. And what I find is, as I guide women through this process of addressing the root causes that are unique to each person, right? It can be unique to each person. Then their body becomes more and more able to not only take care of the virus and get rid of it now, but to maintain even into the future if they're re-exposed. Because a lot of women are told, oh, if you then have sex with your partner and you get re-exposed, you're going to pass it back and forth. And I'm here to say it's not how it works.
Interesting.
Even if we think about it from vaginal health, if your vagina has health, low inflammation, adequate nutrients, adequate immune function, healthy microbiome, it's not going to allow high-risk HPV to survive there.
That makes sense. It's so straightforward, right? It just makes so much sense. I want to talk through very specifically what you do in terms of your protocol and your approach. We have a question in the chat, and I think this is a really good place for it, which is one of the medical approaches to this from a preventative standpoint, of course, is the vaccine. Can you share with us a little bit your thoughts on this?
Mm-hmm. Absolutely. And it is something when women go to the gynecologist, they're going to hear about, okay, here's the HPV vaccine. And as all vaccines, the hope is when they're created is, hey, could this eliminate this virus or this condition? Mm-hmm. And there has been some progress with that. However, I always encourage people, no matter what you're considering swallowing or injecting into your body, to always look at the potential benefits and the potential risks. Mm-hmm. And certainly with the HPV vaccine, you're going to want to look at the potential risks as well, as to understand that the current form of the Gardasil or the HPV vaccine, it is working on 7 of the high-risk types, not all 14. So it doesn't cover all 14 high-risk types, and it's not 100% effective. So many women who have had the vaccine will still test positive for HPV. In fact, women are told, even when you have the vaccine, you still need to go in for a pap smear because you could still have HPV and develop abnormal cells. So you have to know that it's not a fail-safe approach. It is pretty much the only thing that standard medicine has to offer women. There's not a medication they can prescribe, or they don't even have suppositories that they recommend. The only thing they have is to say, well, you can do this vaccine. And when women already are testing positive for high-risk HPV, the doctor might still recommend the vaccine, even though the likelihood of it helping is quite low. So then it becomes women going, wait a minute, I already have this virus.
Right.
How much is the vaccine really going to help me? And so the doctor then is saying, well, the only thing you can do is wait and see if it develops into abnormal cells. Wait and see if you need a surgery. Wait and see if you need a hysterectomy. Wait and see if you get cancer. And I don't know about you, but I don't want to wait and see if any of that happens if I could actually start taking action. So yes, the vaccine is one tool in the toolbox, but to me, it's not 100% solution, and it's definitely not addressing the real root causes of the situation, because many women who've had the vaccine still develop cervical cancer.
Well, I think those are some really important points, that it's only 7 of the 14 high-risk types still isn't 100% effective. And so it sounds like whether or not somebody chooses to get the vaccine, which is a highly personal decision, obviously you need to weigh that against, the benefits and the risks in your personal context. Sounds like either way, following this protocol and really supporting your own body's natural immune resilience and capacity to handle this and any other virus that you're exposed to is only going to benefit you, whether or not you have had the vaccine.
We see amazing transformations with women's health because they first contact me in fear, going, wait a minute, my doctor's talking about a hysterectomy, and maybe these women are in their 30s and they're like, I want to have a pregnancy. I'm not ready for a hysterectomy. Is there anything else I can do? Yeah. And lo and behold, as I guide them through this protocol and this approach, not only do we heal their cervix using natural approaches, because the body can heal the cervix, and we can talk about that some more, but also we get the virus to negative, and in the process, they completely transform their whole health, right? Because now we resolve nutrient deficiencies, we address hormone imbalances, we get their microbiome optimized, we help their nervous system heal from trauma. So now all of a sudden they're like, my energy's better, I'm sleeping better, my mood's better, I lost that weight I needed to lose, and they become actually even more able to get pregnant easily because their body's healthier now.
Totally. Win-win-win across the board. So let's talk about the protocol. What does it involve, and how are you customizing it from client to client?
And this is so important because a lot of times women, they come in, I mean, of course, all of us, we would love to have a magic pill, right? Like a quick fix. Let me just do this, swallow this one thing. And there is online a lot of marketing around certain products that have been researched to use for high-risk HPV. So I just want to mention that you might see.
I'm seeing just in the chat, somebody is saying that my client was offered Mirena, the IUD, to be inserted at the time of the procedure, which didn't make sense. So it's an interesting strategy.
I know. There you go. I know there's sometimes it's like, it really is flabbergasting to think of, what they might hear at the gynecology office that may or may not make any sense, because I mean, I'm sure the doctors want to help, but they don't have the tools, right? They're not learning about nutrition or herbs or lifestyle or root causes. They're not learning this, so they don't have that information to help. And so I don't blame them. I know that it's just not in their training. And yet, as a naturopathic doctor and midwife and for any other functional integrative practitioners, now it is in your training and you can help. And so the thing is that a lot of times women will hear about AHCC, which is a mushroom extract. It's actually from shiitake mushrooms. And there's a company in Japan that patented this part of the shiitake mushroom, and they have paid for a lot of research and marketing. And so it's wonderful because now we have this information about how shiitake mushroom, or this specific extract of shiitake mushroom, can help. And yet I always warn women, because this is the first thing they'll see and hear about. And so a lot of times women will already be buying and taking AHCC. It's important to know that the research shows that it's 63 to 75% effective. It's not 100% effective either. So it's not like you're going to just take a mushroom extract for the rest of your life. That to me is not a solution, right? It's like, what now? That's kind of like green medicine, as you, right?
That's what I call green allopathy. That's green allopathy. That's the most perfect example of it. We're not going to do the deeper foundational work, but here it's not a pill. It's not a procedure. It's not a vaccine, but it's a thing that's natural that you're going to now take for the rest of your life to keep it. I think I'm glad you mentioned that, because I think it's a really good example of this like green allopathic model, which I sadly think slips, the functional world can slip into that very easily because it's what we're familiar with, right? Pill for an ill. So let's just do an herb for an ill or a mushroom for an ill.
and it's for women, it's like they're just grasping for something because they're in a state of fear and survival mode, and they're like, and so I'm glad they're looking for something. And yet it's important to know that many women have been taking AHCC for years and still have HPV. So it's not the end all be all, I wouldn't put all my eggs in that basket, so to speak. I would be like, okay, we might use AHCC, but as part of a comprehensive protocol. And so what I do is I look at all the research, every piece of research I can get my hands on, to say what actually is being researched to be shown effective for this. Anything from vitamins like vitamin C, vitamin E, vitamin A, right? These are all antioxidants, going to help our immune system. Okay, that makes sense. We can also look at herbs like curcumin, green tea, sometimes other mushrooms like Coriolis mushroom, reishi mushroom. There's actually, when you start digging and researching, you'll find so many potential tools. Antiviral herbs like astragalus, andrographis, for that matter, echinacea. So you can go, okay, there's nutrients we can use, there's herbs we can use, there's mushrooms we can use, there's also homeopathic remedies we can use, there's peptides we could use. And then we start to go, then it's almost becomes overwhelming, because it's like, oh my gosh, is this person going to take 50 things? No, that's not a good solution either. to
Right.
take, because, and I actually often see supplements online where they try to put the whole kitchen sink into one product,
Yeah.
and then you don't have adequate doses.
No.
You don't have enough of anything to make a difference.
Such a good point. Such a good point.
So a lot of times that's the other thing that women find is like, oh, I'm just going to take this one, and then it may or may not really get them anywhere because it's not a clinically effective dose. And
Right.
so that's where it took years of case after case and clinical experience to find which nutrients and herbs and mushroom extracts at what doses actually help the majority of women. And so I start with that. I start with, here's a standard list of the nutrients and herbs that I find are most effective. And then, as you mentioned, we have to individualize it. So then we have to say, okay, now we need to get some real blood work here, and not just a CBC. I mean, we of course want a CBC and metabolic panel, but we also need to, what do you think if we check their nutrient levels?
Right.
Which is often not happening in a standard set of blood work. So we have to do the right tests. So we need to be checking, yes, vitamin D. We need to look for iron deficiency, not just from not from an iron level, from a ferritin level.
Yeah.
We need to look at methylation. And this is very much associated with risk for abnormal cells in the body, including on the cervix. So we need to look at homocysteine and methylmalonic acid and see how well is their methylation working and what's the adequate dose for them of methylfolate and the other B vitamins.
Yeah.
And I find over and over again that one of the most common nutrient deficiencies that I see associated with abnormal pap smears that women do not hear about and most doctors are not checking for is iron deficiency. And it's so common anyway, right? And of course, for menstruating women, they have blood loss with their menstrual cycle. But even women who are postmenopausal, who also, by the way, are at risk of HPV over age 50, they also sometimes have iron deficiency. And so we have to be doing the right tests to see which nutrients is she deficient in so we can actually give the right doses.
Can we pause on the iron for a moment? I would love to unpack that a little bit, because one of the things that we also are thinking about with iron, as I understand it, is that when you have an active pathogen, we want to be careful with iron, right? Because we don't want to fuel the pathogen. So how are you navigating that nuance when you're thinking? Because I know iron is one of these ones, right? It's so critical for us and our health. And it's one of these ones that we want to not just jump to, but then when we need it, we really need it. So how are you navigating that complexity?
Interestingly, what I find is with high-risk HPV virus, usually there's not, the inflammation in the body doesn't usually affect that ferritin. Because like say with someone who has autoimmunity, that's where we'll often see where their metabolism of iron shifts. And we may then need to be checking a transferrin to see, do they actually have too much iron or too little iron? And we have to navigate the influence of inflammation that you're referring to. What I find with abnormal pap smears is usually it's more straightforward. It luckily isn't impacting that so much. And so we can more clearly see that they're low in iron. And oftentimes when I start to look deeper, it's because their diet is low in iron.
Right.
A lot of times women are even hearing that they need to be following a plant-based diet for dealing with HPV. And what I see is I actually get concerned about that, because what can happen too often with a plant-based diet is women are not getting enough iron or B vitamins, which is also extremely important, and they're not getting enough protein.
Yeah.
So between those three, not enough protein, not enough iron, not enough B vitamins, actually, I get very cautious about a plant-based diet. And so if a woman's following a plant-based diet, I really help her to make sure she's getting enough of those nutrients. Otherwise, it could be putting her at risk.
And I'm sure that that's a complicated conversation, since there's so much in the kind of zeitgeist, especially when you talk about diets for cancer. And so somebody with high risk HPV is obviously acutely aware of the cancer risk, is trying to prevent that. And there's a lot of hype around the plant-based diets, that is the best diet for turning around cancer. I'd be really interested in how you're navigating that conversation. I think that would be very helpful for clinicians here. Our model as well. I have not yet found a moment where, or, certainly not about a long-term case where a plant-based diet makes sense in the long term. I can see it in a short period, therapeutic, cleanse. There's moments where it can make sense, but in the long term, because of the deficiency in nutrients that happens inevitably, at some point, might take a little bit longer for one person than another, but it happens inevitably. It's certainly never the diet that we're recommending. And, I can think of many conversations that I've had with people who are considering working with me. And, I'm not actually willing to work with somebody. I don't know how to help them is the reality of it. I'm not going to waste their time and money if they're not going to do what I know how to do and what I've seen through, almost 20 years of experience in this field now. So I'm just curious, what are some of the ways that you have that conversation so that they can really hear you?
Well, one way, and this is such a great question, one way is I say, it's not that you're going to give up the plant-based diet altogether. You're going to have a partially or mostly plant-based diet, right? We're not going to not have plants. We're going to have a plant-based diet. And you can have some meals that are completely plant-based too. It's just how do we also bring in, make sure we're getting enough of these nutrients. And one of the easiest ways to get iron, B vitamins, and protein is with some animal protein. And so we find ways to integrate it. It doesn't have to be every meal, but just integrate it in. So at least we're getting those nutrients in a more effective way. And you can still also search for and be more mindful of, okay, if I'm trying to do this in a plant-based way, how am I going to do it? And so women start to see how difficult that can be. But you can do some modification of, not either or, but and how do we do, animal protein and plant-based? And the other thing is, if and when someone is diagnosed with cancer, we might shift gears a little bit, right? We might have a time period where they may be following, let's say, even a fasting mimicking diet, which is going to be higher carb and lower protein and maybe more plant-based. And so there might be a period of time where they might be leaning in more of that direction if and when they are diagnosed with cancer. Right. But what I find is when what I specialize in especially is helping to prevent it from progressing to cancer. And in that scenario, we need to be thinking about getting those nutrients in when your body's still able to use them effectively. And so we need to be knowing that there's nuances of if and when and how. It's not just a one size fits all.
Yeah, that's so helpful. Such helpful clarification. So just to go back to your protocol overall, so we're talking about some of the tests that you're working with. So you mentioned the CMP, CBC, the vitamin D, an iron panel, full iron panel, not just the serum iron marker. You're looking for methylation status with homocysteine and the MMA. Anything else that you're looking at regularly with these folks?
I definitely do look at CRP because I am looking for inflammation. There's some cases where that will show up, and their hemoglobin A1C and any other markers related to blood sugar levels, fasting glucose, fasting insulin, because research also shows that when women have blood sugar fluctuations, they're at higher risk of high-risk HPV and abnormal cells. So we need to come back to focusing on the blood sugar again. And of course, that makes such a difference, right? And sometimes the blood sugar is being thrown off by cortisol. So I'm also looking at cortisol levels anyway, because I'm looking for what is the impact of stress on their body. And so I'm looking at a 4-point cortisol, usually a salivary 4-point cortisol, to say, because what I see is when women have either too high or too low cortisol, they have increased risk. So we can't assume that it's only high cortisol. It could be high or low cortisol that's involved. And I can go on from there, but I just start being a detective and looking at okay, let's turn every stone and say, where's the imbalance happening in her body? And for one person, it might be more about the high blood sugar or low blood sugar for that matter, and another person, it might be more about their nutrient deficiencies or both.
How much, or if at all, are you looking at toxins? Are you digging into toxin testing? I know that,
yes,
mold and mycotoxins, such a big issue for people, environmental toxins outside of that, or like chemicals and heavy metals. Are you taking a look at that component as well?
Absolutely. And it might not be the first thing I do for every case, but certainly once we get through, okay, we looked in the blood work. What can we find there? We're going to look at I look at the gut too. That's high priority for me. Like, is there leaky gut? Is there gut microbiome imbalances? We can also look for vaginal microbiome imbalances. By the way, there's PCR analysis of the vaginal microbiome, so we can see is what's happening vaginally. Is that the cause? We're going to look at, I even look at adrenaline and neurotransmitter levels. We look at estrogen, progesterone, and estrogen detoxification. We look at, so I'm kind of working down the list. And so if we still see like, wait a minute, like if I find like this doesn't feel like it's explaining everything, there's got to be something else going on. And I'm always asking about toxin exposure when I'm meeting with women, right? Do you know if you might have been exposed to mold? Are you aware of any other toxins you're exposed to? So I'm always screening for toxin exposure. But if I start seeing symptoms like sinus congestion, headaches, rashes, and then if I start seeing signs in their results that make me think mold, I'm going to start going, wait a minute, I think there's a toxin going on here, and we'll run urine toxin mold or mold toxin panels, as well as you're mentioning, environmental toxin panels. I've seen women who have severely elevated glyphosate, for example, from working on a farm. Mm-hmm. And lo and behold, we realize, oh my gosh, this glyphosate is related to her CIN3 on her cervix. So then I can guide to detoxify from mold or glyphosate or whatever toxins we find. And it of course makes such a huge difference, right? Of course, the body can protect us from HPV if it doesn't have all these toxins around inhibiting the process.
Absolutely. As you're going along, how are you evaluating progress? Are you retesting the virus, I'm assuming? Mm-hmm. And then at what intervals, and anything else that you're looking at? It's not, I mean, because I don't think of this, and actually we haven't talked about this really at all, but I don't think of this as something that presents symptomatically until it's escalated, does it? Right? No, it's symptom-free. Right?
So the low-risk types of HPV can cause warts. So women might find a genital wart. That's a low-risk type. Those are not associated with cancer risk. Right. But the high-risk types, there are no symptoms in the textbooks, right? There's no symptoms. And yet, so this is why it's so shocking when women find out, because they're like, I had no idea that I had, there's not a discharge or odor or itching or burning or pain or anything. And so women are like, well, what are you talking about that I have abnormal cells on my cervix? I had no idea. And yet then I start looking for symptoms, right? Yeah. And what I find is there usually are symptoms going on in their body. They just didn't know it was related, right? So women are often experiencing fatigue, anxiety, sleep issues, depression, and gut health issues, bloating, any of the gut disturbance issue, diarrhea, constipation, rashes, weight gain, and they may also have other vaginal infections. Like it's very common to also have BV yeast, like recurrent BV yeast or bladder infections, because the whole environment is out of sync, right? And so so then when we start looking, we start seeing these associated symptoms that were, the HPV was just one of the blinking red lights. Actually, there's a lot of other signs from the body as well, showing us that there's imbalance happening that allowed the virus to cause abnormal cells.
So fascinating. Mm-hmm. At what type of interval are you retesting? Like monthly, every 6 months?
You can, and it kind of depends on the case, but because now women can do home testing for HPV that's quite accurate. So it's going to depend on, when is the next doctor's appointment? So I'll say, whenever I'm looking at a case, I'm like thinking, okay, they probably recently went to the doctor and had a pap or colposcopy, an HPV test, and that's why they're looking for help and information. So their doctor might have said, well, come back in 3 months, or come back in 6 months, or come back in 12 months. So they usually already will have a next doctor's appointment set. And that might be our next opportunity to see how things are doing. So we say the doctor says, okay, it's low grade abnormal cells, come back in 6 months to retest. So that gives us 6 months to work on all of this. And then she can go back at the 6-month visit and say, and be knowing, hey, I've been taking action, is a great likelihood that it's going to be improved and maybe even fully cleared by then. If a doctor says, oh, HPV positive, come back in 12 months. And the woman gets to 6 months and she's like, I don't want to wait another 6 months. I want to know if it's gone yet. Then that's when she might do a home test for HPV and see, okay, is it down to negative? And then that gives them some feedback. Or if it's still positive, then they'll be like, okay, what have I not addressed yet? Let me go back to the drawing board, so to speak, and see what else didn't we look at yet? How do we, and sometimes it's simply a matter of time, right? And consistency. We know that from so many health issues, the more consistent we are with diet changes, because we didn't talk about that, but diet changes, lifestyle changes, stress recovery, implementing clinical nutrients, healing adrenals like cortisol and adrenaline, healing the gut. It takes time. So as the time goes by of them doing this healing work, their likelihood of clearing the virus goes up and up and up.
And are you seeing it? I hate this question when people ask it of me, so I'm sorry that I'm asking it of you. But I know the question is always there, so let's just address it. And what kind of timeline are we thinking? I mean, I know it's always going to vary from person to person, but is, somebody who is really disciplined and you've identified the key triggers, could it be turned around within a matter of like 3 to 6 months?
Well, I've had some cases where the woman just happened to have another doctor's appointment, let's say in 1 month, 2 months, 3 months. And so I've seen cases of women who cleared it completely within 1 month.
Wow.
Sometimes 2 months, sometimes 3 months, and this is when they just go, they basically have hit their limit with this situation. And they're like, I'm going to do whatever I have to do. I'm going to be all in. I'm going to make my diet changes. By the way, one of the biggest diet changes to make is to avoid sugar and alcohol, because sugar and alcohol, we know, suppress the immune system. Yeah. So it's finally as women going, I'm going to avoid sugar. And it's a high motivation at that point, right? If the doctor's saying you might get hysterectomy, women are like, okay, I'm not having sugar and alcohol anymore. Yeah. And you go.
Uterus. Cookies, uterus.
Exactly. You start to go, this is a decision here. Let me be all in and see what happens. And so I've seen cases of, let's say, vein 3 is when the abnormal cells are in the vagina. This is a woman who's already had a hysterectomy. Talk about heartbreaking. A woman who's been dealing with HPV, has a hysterectomy, still has the virus because the virus doesn't go with the surgery. The virus is still hanging out there. Then it causes abnormal cells vaginally. They can't do another surgery. Right. Now they're treating abnormal cells with chemotherapy vaginally, and women are like, what? No one told me this was this situation. Right. This was going to happen. Within 1 month, I've seen cases completely reverse vein 3 and HPV to negative and stay negative, not come back again. It can go quickly, Margaret. It could be within a 1 month to 3 months. But I want to share with you this case of a woman who, 70 years old, testing positive for HPV for more than 7 years, because maybe she wasn't even tested before that. Right. So she must have tested positive by age 63. Okay. Dealing with HPV, has type 2 diabetes, which puts her more at risk because of the blood sugar. She follows my protocol over a year. Into 17 months, she goes back for her pap smear, and it is gone. HPV gone, abnormal cells gone, and talk about celebrating. She is so happy, right?
That's amazing.
Can you imagine 70 years old? Yeah. She is able to make these changes. And of course, not only did the virus go away, but her diabetes improved.
I was going to say, how's that blood sugar handling? I bet it's completely resolved.
And she is on cloud 9 because she was committed to herself. I always ask women, what would you want to tell other women? And she says, just don't give up. There's going to be days that are tough and days where you feel doubtful, but just don't give up and just keep going, because you're going to get there if you just stay after it.
I realize we only have a few minutes left. I want to make sure that we've covered some of the key. So you mentioned the dietary strategies, and I know, again, it's probably going to differ a little bit from person to person. So if you could just quick hit some of the key dietary strategies, key lifestyle strategies, and if there are certain nutrients that you have found to be particularly helpful, that would be great. So obviously no sugar and alcohol. What else?
Well, and we know that cigarette smoking increases risk. So that would be right off the top. I'd definitely help help women to quit smoking if they're still smoking. I would also then, definitely like start, like we said, get these nutrients in a nutrient dense diet, get the colorful fruits and vegetables, but also get the healthy amount of protein in the diet and balanced blood sugar levels. That makes a huge difference. And then definitely be teaching women how to recover from stress on a daily basis, whether that's breath work, journaling, meditation, mindfulness, time in nature, connecting with themselves, and healing on an emotional level. This is not just a physical, even though we're looking at the cervix and seeing abnormal cells, this is not just a physical illness. This is absolutely emotional and spiritual, energetic as well. And so we need to be helping women heal on mind, body, spirit levels. And then from there, I'm looking at I would say start with a really high quality multivitamin that contains methylfolate, not folic acid. You're going to hear about folic acid, but as you know, it's the not activated form that 50% of us really don't use very well. So might as well get a multivitamin with methylfolate and all the other active nutrients, because now you have a base of nutrients in a multi, and then you can add from there clinical doses of, for example, vitamin C, vitamin A, green tea, curcumin. And so I'm going down that kind of a list of like, let's get clinical doses. And as a naturopathic doctor, I'm also a clinical nutritionist. And so as you train your providers, you've got that ability to say, hey, we're not just going to get minimal nutrition. We're going to get clinically effective doses, and we can use clinically effective doses safely and effectively for women. And this is, by the way, oral as well as vaginal. So I also guide women to use vaginal suppositories that contain nutrients, herbs, and probiotics, because they can safely and effectively heal the vaginal environment while we heal the rest of their body. And so these are key aspects of the protocol, in addition to identifying the root causes, helping women to see, to be advocating for themselves in terms of their lab work, and advocating for themselves in terms of discovering what else is going in their body that might be inhibiting their body from protecting them. And then once they get to negative, the protocol is all about helping them maintain. What did they learn through this process? Maybe their body requires a little bit extra folate on a regular basis. Maybe their body, maybe they need to continue to avoid certain food sensitivities like gluten. By the way, I see a high correlation with gluten sensitivity and normal cells. So I test for that. Like if we see gluten sensitivity, then I help them avoid gluten. So it's got to be looking at that whole body approach and then helping them to create a maintenance plan. I don't know if I want to make sure your audience knows that I'm now training practitioners in this protocol.
Awesome. That's fantastic. I would love to hear more information. 2 quick questions before we get into that, and then let's talk about exactly that. Vaginal suppositories you just mentioned, and I had the question, and I see Ellen in the chat has the question. I've not heard of this before. Is there a brand name? Is this something that, we're able to get on like a full script? Can you tell us a little bit more about those really quickly?
Well, what happens is years ago, these vaginal suppositories were available even over the counter at the health food store, let alone through full script. But then the FDA started regulating vaginal suppositories. So at this point in time, they have to be through either compounding pharmacy or I have them custom made. So as a practitioner, I have the formula that I know that is working well for women, and then I have them produced. So that's what you're going to want to do, is you're going to want to learn the formula that I'm finding is effective so you can have them made.
That's fantastic. One last question, then let's talk about your program and how you can support people who want to dive deep into this. We talked about testing. There was somebody in the chat, I've been wanting to make sure I did not forget about this, who works in a dental office. And you talked about this, the kind of regular screening. Is there a specific test that you would recommend from a dentistry perspective that people integrate into their practice? And then there was a question about the Bristol oral test. That's one oral test. Does that test for HPV? I'm not sure if you're familiar with that test, but what would you recommend for somebody from that perspective?
And I don't know the specific lab. But I know also from Sanda, our friend Sanda, the dentist, she told me that that she orders this test in her practice. So we can ask her exactly which lab that she's recommending and ordering from. But all I know is it is possible as a dentist to get an high-risk HPV screening test, and that way, then you can provide that to patients. Now, the important thing I think is whenever we're testing for something, we want to make sure we know how to support the person with the results. Right. So if we run a test and we see that it's positive, we don't want to just send them out the door with no information and no help. We want to be able to say, hey, if we're going to run this test, we're going to help you whatever the results are. And so that's a key. It's a missing piece right now. I think that may be why it's not being done, because practitioners don't know what to tell the person. Right. So they're not going to test for it. But I'm saying that's not a solution either. We need to test and give information about what you can do about it. I
love that. That's helpful. And I can reach out to Dr. Sanda and ask her if the name of that test. Talk to us about your practitioner training and how people can get more Dr. Doni. I feel like we could chat all night about this. So
absolutely.
Talk to us about that.
Such an important topic. And I'm so glad to get the information, because it's the thing is, like, as women, we don't talk to each other about pap smears and HPV. And in fact, most women go through the treatment of abnormal pap smear and cervical cancer alone. They're afraid to even tell their friends, their family. And so I'm just saying, hey, let's change that. Women don't need to go through this alone. Let's break the stigma and let's start talking about it and let's start helping them. And so if you're interested in helping more women in your practices to address abnormal pap and clear HPV to negative and using all of these tools, then that's the perfect opportunity to do the certification program. So it's a Dr. Doni's HPV protocol certification program, and it's over a 6-month period online. And I teach you every step of the way exactly the research and what I see is working, everything from diet and the supplements and the doses and the suppositories and how to do that, and addressing the root causes so that you can take this protocol and use it for yourselves and for your patients.
That's wonderful. I'm seeing that I think Julie threw in the chat. So we have a couple of special offers for our practitioners. Thank you so much. So those 2 links are there in the chat. And for those who are listening to us or are watching this on YouTube, then we'll make sure that those links are in the show notes. Thank you so much. This is wonderful resources. Dr. Doni, you're doing such great work. Thank you so much for this conversation. I learned a ton. I mean, I think what I knew about HPV coming in, of course, elevated risk of cancer. I knew it was an STD. And then I was like, I don't actually know much more beyond that, other than that's like the topic of that's the reason for the PAP for the vast majority, for me, at least, or, in the past, that's the reason why I've thought about doing it. And I know that it's become a bit of a hot button topic when we talk about vaccines. So thank you also for handling that so graciously. I like to keep it nice and balanced and not one wild way or the other. But I love the fact that this approach is really, it makes so much sense. What you're doing makes so much sense.
We can be reducing cervical cancer rates by helping women heal their bodies and become resilient to this virus and be able to go back to intimacy with their partner, dating, and fertility and pregnancy, let alone women who are postmenopausal, not living in fear of this virus anymore. It's huge. And so it has become my mission to reduce rates of cervical cancer and other HPV related cancer. And that's why I want to train more practitioners in how to use this protocol, because it shouldn't just be we need a lot of us doing this so that we can really change healthcare for women in this way.
I love it. Well, thank you so much for everything that you're doing. And for those of you who are here with us, thank you so much for your fantastic questions. And for those of us listening later on, I hope this has been very valuable to you as much as it has been for me and for our community here. Thank you so much, everybody. Have a wonderful night.
Thank you.